Good day, everyone. In today's online lecture, I will show you how you can generate competencies through the use of task analysis. The competency analysis or task analysis will help you identify in much more detail what you want to achieve as your intended learning outcome for the course, for the whole program, and of course for specific sessions. So let's start. If you read the guideline released by CHED a few years back in relation to outcome-based education, you will come across this particular framework for outcome-based education, where you have it's actually similar to what we have discussed the last time, where you try to identify your vision, mission, and goal, your institutional outcomes, of course, in your program outcome, and all of that will come from a detailed analysis. It will not just come from nowhere. It will have to be scientifically generated. And as you will notice in this illustration, the upper three concepts, the institutional outcomes and program outcomes, should be the one that will determine the elements of your course design in the bottom. So in this particular presentation, I will show you how we can generate your program outcomes, your course outcome, and of course your session outcomes or learning outcomes based on the result of your task analysis. So let me start by showing you an example of a very comprehensive competency analysis. It was done by WHO. It's titled Sexual and Reproductive Health Core Competencies in Primary Care. I'm fortunate to be part of the technical panel that helped develop this particular competency paper. The actual paper is available in your course site, and you can look at the whole analysis. And actually, in some of the sections, you may be able to use the competency analysis or the competency analysis in your own process of designing your own community-based training program. So if you look at the core competencies for sexual and reproductive health at the primary care level, which is of course very similar to most of your design or most of what you intend to do, you will see that there are four major domains that it's being addressed by the analysis. So if you look at the domains, you have the attitude, knowledge, ethics, and human rights. And then you have leadership, you have clinical setting service provision, the nearest to it will be your clinical health services skills, and this is something that will be important for you, community work, education, and counseling. I will give some sample of that because that will be, I'm sure, appropriate to most of your projects. But let's just look at quickly at what are these domains and how they were broken down into competencies in the competency analysis. So for example, if you look at attitude knowledge, which is baseline, so it's more like these are all the knowledge, attitude that will be needed by the three other elements, meaning you have to have the correct attitude, you have to have the correct knowledge, you have to have the proper ethical perspective, and you know about human rights, because all of those knowledge, skills, and attitude related to all those ethics and human rights are general knowledge and skills that will be very important in your performance of role as a community or primary healthcare provider in the area of sexual and reproductive health. And then you have the second domain, which is leadership, meaning to them you don't just you are not just a health provider, you're also a leader in a community setting, and if you can look at the details, you will be able to see that you have like say in the details, perform a leadership role, and you notice the task is broken down into knowledge, skills, What will be the knowledge needed to be able to perform leadership role or be able to achieve the domain in the leadership domain, and the skills needed to address or to become leaders in the community setting and related to the performance of reproductive health or achievement of sex and reproductive health. Then you have, of course, the clinical skills. These are the skills needed to perform procedures at the sexual reproductive health level, meaning, for example, there was sharing about uh, using the visual technique in early cervical cancer detection. So you need to have skills if you're going to doing internal medicine primary care level services. You need to have the skills, and these skills will have to be identified. What exactly are those? And of course, community work, which is very similar to what we want to do. So the third domain has 4 general competencies, health provider, including community education, counseling, and assessment of the client. And if you look further into some of the details, you will see something that is very similar to probably what you will need in your own projects. For example, in terms of Dr. Guzman's discussion on cultural competency, so you have the socio-cultural perspective, and you go break down, look at the knowledge, and see it's very similar. You can just actually translate them into your own setting, and they will be almost, you can use them already. And so from this, for example, we can now illustrate how the whole thing actually interrelates. So from the domain, you're able to identify, or you go to the next step of identifying the competencies, and from the competencies you identify the tasks that will be needed to perform the competencies and the knowledge and skills needed to perform the task. So you go to that particular stages of development. The same way, for example, in another competency requirement for the domain of community work, community education, you have plan a counseling session. So based on that, you try to identify what. So you ask yourself, what knowledge and skills do I need to provide so that my target audience will be able to perform the task of planning and actually executing a counseling session for my students. It could be your adolescent, it could be parents, it could be the teachers doing your counseling for dental hygiene and so on. So now, how do we break down the details? What you just saw are examples of how a domain was broken down into its competency, and how the competencies were broken down into the respective tasks, and how from the task you try to identify the knowledge and skill attitude requirement. So let me illustrate it now in relation to the course that you are doing. So we define competency analysis. Let's say, for example, you have a prepare patient for surgery. Then, of course, to be able to perform patient or to prepare a patient for surgery, if you're an anesthesiologist or you're a nurse or you're a pediatrician, to prepare a patient for surgery because you're the pediatric consult, then you should know how to perform the needed tasks within the responsibility of preparing patients for surgery, like giving pre-op medication, take patient's vital sign, and check whatever materials needed to perform the procedure. And then, now you know that if you are to give pre-op medication, you need knowledge, skills, attitude. Can you think of some of the knowledge, skills, attitude needed to do pre-op? Of course, you probably need the drugs, medications that are needed to perform pre-op, and PKPD, all these pharmaceutical interventions for pre-op. You need to know what are the indications or contraindications of a certain pre-op drug. Is the patient diabetic? Is the patient hypertensive? Or is the patient suffering from other comorbidity that may impact on your choice of pre-op medication? course, you need skills in analysis, skills in giving the drug, the different type of delivery of the drug. It could be IV, could be nasal, through nasal cannula or whatever. And if you're at the level of the nurse, you need to know how to take the patient's vital sign. So you know the normal and abnormal vital signs. And of course, you need to check for example, if you're a surgical nurse, you need to check all the surgical equipment or other instruments needed to perform the procedure. And to do that, you need to know the different instruments, how they look like, what, how do you prepare them, how do you observe, for example, proper care so that you will, in terms of making sure that the instruments are safe and making sure that the instruments are ready for the performance of surgery. So what will happen is that in this example, the competency analysis can be converted into a competency table where you have something like what you see now on the screen, where you have a patient, prepare patient for surgery, and first column will be, one of the tasks will be check surgery materials. Number two, give a pre-op medication, or number three, take patient's vital sign. Of course, you can arrange them in a logical sequence, like probably take vital sign first before the give pre-op medication. If you are really very particular with the way the tasks will be performed. And it's important. If you think the task sequence is important, then you may want to arrange them that way. And based on the check surgery materials, then you should now be able to identify the knowledge, skills requirement or attitude requirement for checking. You may be just saying it's just checking surgery materials or surgery equipment. What's the attitude? Of course, there are attitudes related to that. Like, say, attitude related to safety, attitude related to being ensure quality of materials. So there are that kind of attitude that may be needed. And let's say, for example, in your course, so in your proposal, you have here training program for interns or for internal and primary health care. So if you are to look at your statement, where is the general outcome in that statement? So you say, for example, provide primary health care, especially to those in the underserved areas. If you want to provide those or to make them do that, what will be the competency requirement? What task will they do? So if you're a primary healthcare provider, will that also involve the similar competency requirement for a resident in internal med? So will that probably also prepare patients? Will that be perform physical examination? And probably what you will have is beyond providing direct health services, because you're looking into primary care competencies like counseling or family therapy, or coordinating with the local health officials. These are, if you look at the domains earlier in the reproductive health leadership role. Because if you're in a primary care level facility, you'll surely be dealing with community members, leaders of the community, and you need to know how to negotiate. You need how to deal with the system in the local community. And if to do that, then what will be the breakdown of specific tasks that you need to do? So let's say here, cultural competency in the care of our patients in Batangas Medical Center, for example. So if you want to develop cultural competency, then you need to identify task number one. What are the tasks in the cultural competency? Then you can go back to our example. For example, recognizing, one of the tasks is to recognize different practices. But to be able to recognize practices or to respect practices at the attitude level, you need to know those practices. What are the implications of those practices? Not because you are not just because you want to appreciate the traditional belief, that you just don't throw them away if you know that they are really uh, or will hurt the condition of the patient. It's not just enough. Probably what you need is how do you change the person's perspective in relation to a practice, a culture. And in this example, to train public school teachers in relation to oral hygiene. So if you are to train them in relation to oral hygiene, then you have at least two major domain areas or two major domains. The first domain will be on the knowledge skills related to dentistry or oral hygiene, and the other domain will be related to communicating effectively or educating effectively teachers and students on oral hygiene. So that will be two, and that will give you two major competency areas and several subtasks or tasks within each of the domains. So as I said, the domain related to or competency area related to oral hygiene per se, and the other competency area will be in the educating teachers how to perform oral hygiene education. In another example that you sent me, of course, talk about the pediatric hospice palliative care, specialist knowledge and skills in pediatric palliative care. And it will also have two major domains. Probably the one domain will be on the knowledge, attitude, skills in palliative care, and the next domain will be in the area of actual performance of palliative care, and probably that will include communication skills, counseling skills, and all other skills uh, that are separate from the competencies related to the provision of actual palliative care. And I think the last we have wellness promotion, for example, for those in occupational health. So here you talk about probably your teachers are already experienced OT preceptors, but what you want them to do is, are they equipped to perform their role as preceptors at a community setting? So we already know that at the domain of OT, they know. But at the domain of doing work at the community level, do they know? Do they have that competency needed? And you can, as the rest of you can go and read the material that I just shared earlier and look at the third domain that they have. The third domain is related to community work, community education. And there are so many tasks there. Actually, several tasks have been listed. And you can actually just borrow all those and then try to apply them in your own community setting work. It's not bad to cite because other examples, because these examples, as you read, has been discussed, articulated by so many people. It was a global research. If you notice at the acknowledgement, we have people from Asia, people from Africa, people from Europe and the Americas, all participating in defining all the domains. So moving forward from competency and task analysis to statement of outcomes, I would just like to highlight that from the competency table that you saw earlier, like say this example, prepare patient for surgery, check. And going back to the CHED guideline, so prepare patient for surgery can easily be converted into your statement of program outcome, like at the end of the course, at the end of the rotation in surgery, or at the end of nursing, for example, or at the end of anesthesia residency. You should be able to prepare patient for surgery. So we can look at this statement, the highest in the statement of the task analysis, as your terminal competency. But to be able to do that, of course, you need the course outcomes. Probably we'll have a course on surgical instruments, types of instruments, when to use the instrument, how to take care of the instruments. And then you have another module on giving pre-op medications. the drugs used in pre-op, the effect of each drug, indications for the drug, and then taking vital signs as another module. But of course, it could happen that that take vital signs may have been taken already by your participants in another module, then you don't need to address that in the actual course, but nevertheless, you still need to identify them in your task analysis. Because doing so will help to identify competencies or prerequisites that you need to give, or competencies that you need not give because they were already they were already addressed in other courses, but nevertheless you have to identify them, because you may not be able to identify prerequisites if you don't do this. And when you break down the knowledge, skills, attitude that I was saying earlier, then you will be able to identify session outcomes or the smaller learning outcomes. So here, as I illustrated here, so you're together, so to prepare patient for surgery will be your program outcomes. Of course, you can slide it depending on, you can slide it downwards, backwards, depending on where you are at a particular or what level of training you are doing it. So your check surgery materials and give pre-op maybe your course outcomes. It depends on if that's how you organize your course. And the knowledge and skills that you will have to give to your students or to help develop among your students will be your session outcomes. So as you will notice at the top, I put their design backwards, because to design a course, that's what you're doing now, you need to design backwards, meaning you start from the terminal competency, identifying them, and move backwards to the smallest task and the smallest KSA that are needed to perform the program outcome. As you said, for example, you talk about dental hygiene education. So your eventual terminal competency program outcome is for them to be able to conduct oral hygiene education to both teachers and students. So if that's your terminal outcome, your program outcome at the end, then your topics, probably your course topic outcomes, will be related to designing a community, what do you call it, education program for teachers, or plan a program, training program on oral hygiene for teachers and for students. And the other one will be knowledge, understanding and of different oral hygiene concepts and attitude related to oral hygiene. They must be advocates, for example, of oral hygiene. They cannot just be teaching and preparing courses, teaching others, but they themselves are not practicing the good oral hygiene. It's more like you're just trying to promote healthy lungs, and during the workshop, you're being seen by your participants smoking outside, like violating all the recommendations for healthy lifestyle related to and preventing pulmonary carcinoma. So you need to do all those. So that's how you will have to break down your program. And I think by following that sequence, you will be able to identify the necessary competencies and easily translate your task analysis results to statement of outcomes. All you need to do is to convert them to verbs and add all the other elements of a good statement of outcomes, and then you're done. To me, the easiest way to formulate intended learning outcome is to start by doing task analysis. Sometimes we find it difficult to formulate outcomes and statement of outcomes, because you don't know exactly what your student should be able to do, what they will become. So it's important that you go through the steps. This step is useful for you in in most of your courses. You will use this in curriculum design. You will use this in instructional design, and you will use it in so many other things, even in evaluation, research. So actually, the easiest way is for you to start by looking into identifying the roles, and the role is already we can talk about the roles that you stated. The roles are, you can identify the role from your paper, the first part of your paper, where you said, oh, the role of my graduate will be to provide oral hygiene education. So if that's the role, what are the responsibilities of a person doing an oral hygiene education? Then one of the responsibilities is to design the course, and the other one, of course, is to evaluate the course, or to implement the course and then evaluate the course. Or what about if you say the role is to conduct an early detection of cervical cancer through the use of the visual technique? Then if that's the role, then what are the responsibilities? One of the responsibility, for example, is to convince a woman, a mother, or a high-risk person to submit themselves for cervical, um, what do you call it, for early cervical screening. See, so you need to do that. And then what are the other tasks or the other responsibilities from the role of providing early detection or screening for cervical cancer? The other responsibilities, of course, to perform the actual cervical screening procedure, and another responsibility is to educate, whatever the results, to educate the woman who just went through the process, or educate the whole community about the what do you call it, the positive role of early detection or early screening, or submitting yourself to early screening in obstetrics or cervical cancer control. So these are all the things that you can do, uh, even with going back to internal medicine, primary care physician. So what is the role of primary care physician? But what will be the responsibilities? Of course, the responsibility will be to provide the direct services. But is that the only role they will play in the community level? Probably they will also train general practitioners in the area, provide them with training on some clinical skills that may not be available to those rural health physicians or general practitioners who've been in practice for the last 20 years and probably are not updating themselves. So these are the things that you can do. And if you're able to define them, break them down from their competencies, from the role to responsibilities to the tasks, and then to the necessary KSA, then you will be able to really develop or produce a relevant, appropriate training program. You don't just load your training with topics. You load your training with topics that you think are essential as determined by the task analysis that you do. Okay, so happy task analysis. See you in the next session. Good day.